Welcome to the segment on heart valve repair or replacement surgery. Here you'll learn how and why heart valve surgery is done, how to prepare, and what you can expect before, during, and right after your surgery. In a healthy heart, the valves ensure the proper one-way flow of blood into, through, and out of the heart. If a heart valve is damaged or diseased, it may fail to open and close correctly. Not enough blood flows through, or blood leaks back through the valve the wrong way. This puts extra strain on your heart. Your heart has to work harder to pump the same amount of blood. Valve repair or replacement can restore the normal flow of blood, easing the strain on your heart. This usually eases your symptoms too. Heart valve repair can sometimes be done in the cardiac cath lab. Other times, it requires heart surgery. To repair a heart valve, your surgeon will reshape the valve to make it work better. For example, your surgeon may remove extra tissue from the valve or strengthen parts of the valve by sewing a ring around its opening. Your surgeon will give you specific information on which valve is affected and how the repair will be done.
August of 2007, I had a mitral valve replacement, and shortly after on my follow-up echo, unfortunately, we found a small leak, or a pretty good leak in my aortic valves, and therefore in August of 2008, I went in for a aortic valve replacement. Well, one thing I would say is to trust your surgeon. You need to talk to your surgeon, ask him any questions that you can think of. What I like to do is I wrote down all the questions that I had, went to the surgeon and asked him all the questions. It made me a lot more confident in the surgeon, made me feel a little bit better about going in for the surgery.
If your heart valve can't be repaired, your surgeon will replace it with a mechanical or biological valve. Your doctor will talk with you about which type of valve will be used in your surgery. Mechanical valves are usually made of plastic, metal, or cloth. They are quite durable. However, they require the lifelong use of warfarin, Coumadin, to help prevent blood clots. Biological valves come from human donors or from animals, usually pigs. They tend not to last as long as mechanical valves, but you need to take warfarin for only a few months after surgery. Different hospitals and surgical teams have slightly different processes, but there are some basic ways that most teams help you prepare for your surgery. Before the surgery, you'll meet the members of your surgical team, learn about the surgery plan, and ask questions. To give your team all the information they need for surgery, you'll probably have tests such as a breathing test, a chest X-ray, and blood and urine tests. You may need to stop or start taking certain medications before your surgery. You might be asked to take some steps ahead of time to protect your skin from infection, such as using an antibacterial nasal ointment or showering with antibacterial soap. Finally, you'll probably be told not to eat or drink anything after midnight the day before your surgery. Before the surgery begins, you'll change into a hospital gown, have the hair clipped in the area where the surgeon will make incisions, have your blood sugar checked, and have an IV started so that fluids and medication can be given through your veins. You'll also meet briefly with your surgical team members. The surgeon can answer any remaining questions you have. The anesthesiologist will explain his or her role and talk about the plan for preventing any pain while you sleep through the surgery. If you've come with family or friends, they can get settled in the surgical waiting room. Open heart surgery lasts at least several hours. The length of the surgery depends on the type of valve problem you have and the type of repair or replacement. While your surgical team will follow a plan tailored to your specific needs, the surgery usually includes several elements. You'll have medication, so you can sleep and be free of pain during the surgery. Your airways will be kept open with a tube connected to a breathing machine called a ventilator. The surgeon will reach your heart through a chest incision, a cut. A heart-lung bypass machine will take over the work of your lungs and heart and keep your blood circulating. The team will repair or replace the heart valve, then close the chest and other incisions. While you're in surgery, a member of the operating room staff will visit or call the waiting room to update your loved ones. When the surgery is over, your surgeon will come out and talk to them.
My wife did very well. She had her moments when she struggled with it, but she'd just come and talk to me or talk to her parents when she's feeling down. But my mom, she had the roughest time. She actually has a mitral valve leak also. So she was really upset and worried about me going in and worried about if she ever has to go in, and it just worried her a ton. She thought she was going to have a heart attack from it, but luckily she didn't. Well, this is a pretty common thing. There are many people that go through it, and the success rate is very, very high. And that's one thing that really helped me, is knowing that I'm not the only one that's had to go through it.
After your heart valve surgery, you'll move to the intensive care unit, often called the ICU. In the ICU, we'll support your initial recovery and focus on preventing complications. The ICU can be an intimidating place, so it may help to know what you and your loved ones will experience there. You'll see monitoring equipment that measures your heart rate, takes your vital signs, and so on. We'll check your blood sugar. The surgery can temporarily increase your blood sugar, so we monitor it before and after. You may receive insulin for a few days if your blood sugar level is too high. You'll experience some puffiness, a normal result of the fluids given during surgery. The swelling will gradually go away over the next few days. You'll see a variety of tubes. Some tubes drain blood and fluids, and other tubes deliver fluids and medication. You'll also have a ventilator and tube to help you breathe. You won't be able to talk, and your hands will be secured to protect the tube, but you'll have medications to help you relax. As soon as you can breathe on your own, the tube will be removed. In the ICU, you'll start working with respiratory therapists who will help you breathe deeply and cough, and use a spirometer to measure and increase your breathing capacity. You'll also work with physical therapists or therapists from cardiac rehab, a program of education, support, and supervised exercise. You'll gently move your arms and legs or begin walking with support. You'll have support stockings, often called TED hose, to prevent blood clots, improve circulation, and reduce swelling in your legs.
In ICU, they would sit me up. At first they have you laying down, and then they would sit you up and have you sit up for a little while on your own and then lay you back down. And then I was able to walk from ICU to the cardiac floor, which was quite surprising. I surprised myself on that one. And then I think it was 2 or 3 times a day I'd go walking around the halls.
It is important to control your level of pain after the surgery, so we will frequently ask you to rate your pain from 0, no pain, to 10, the worst pain. We want to make sure your pain level is below a 5, so don't try to be a hero. Answer the question honestly and ask for more pain medication if you need it. Once your condition is stable, you'll be moved to a cardiac unit until you're well enough to go home. Moving out of the ICU is an important milestone. It means your health is improving. Here's what you can expect in the cardiac unit: continued monitoring and treatment to promote your recovery, increased activity to build your strength and lower the chance of complications, continued work with physical therapy or cardiac rehab, and home instructions to help you prepare to go home from the hospital. If you have questions about your valve surgery, please feel free to ask someone in your care team. To learn more about how to care for yourself once you go home, watch the segment called Recovery After Open Heart Surgery.